Most amputations start years earlier when blood flow to the limb quietly fails. It starts to fail in the small vessels and builds up into failure of the large vessels. Every 30 seconds, somebody loses a limb to amputation. Most of these amputations began long before the wound. What you'll learn today is that no option critical limb ischemia is no longer no option. You actually have an option. You can use your stem cells to regenerate circulation to your toes, feet, and leg, and save your limb from amputation. I'm Thomas Smeenk, and after years of studying peripheral arterial disease and critical limb ischemia and the treatment of it using stem cells that come from the patient's own body, I believe this research deserves your attention because we define and redefine what is possible with respect to critical limb ischemia. The reality of no option critical limb ischemia patients is that they lose bypass option. They lose an option for stent to open the large vessel. They have a multi-level of occlusion to the small vessels and the large vessels. They have wounds that will not heal. They have ischemic rest pain, and they essentially lose all options, and the limb has to be amputated in order to save their life. Our published research shows across 3 studies of critical limb ischemia. In the first study, 83% of patients saved their limb from otherwise certain amputation. In the second study, of 20 subjects, 10 received normal care, and all were followed for 2 years. In the normal care group, there were 2 deaths, 20% mortality, and 75% of limbs were amputated. In the treatment group, there was 0% mortality and 70% of limbs saved from amputation. That was followed by our double-blind randomized phase 2 clinical trial completed in 11 centers across North America. 93.5% of treated saved their limb from amputation. The University of Toronto and the University of British Columbia delivered a keynote address to the 41st meeting of vascular surgeons, and they stated that 83% of the patients they followed for 4.5 years had healing of ulcers, cessation of pain, and saved their limb from amputation, compared to a 50% mortality rate in this patient population at 5 years. Let me explain how ACP works. ACP stands for angiogenic cell precursor. That means it is a stem cell that is educated to create new circulation where the body signals that need. The process is very simple. If you have ever donated blood, that is step 1 of the procedure. And 7 days later, you're in a pre-scheduled appointment with the treating physician who injects ACP into the calf muscle of your affected limb. Because these cells are your cells, they're your DNA, they have a built-in GPS. They have a built-in chemical and natural signaling process to home to the site of need, engraft at that site of need, and regenerate it, and recruit other stem cells that are circulating in the blood to that site of regeneration to help close the wound on the limb. 93.5% of patients treated in our phase 2 clinical trial experience healing of ulcers and cessation of pain. Here is what patients and their physicians need to know today. Hemostemix has a clinical trial underway, and we are recruiting patients to be treated under a phase 1 protocol. This means that you can join a clinical trial and be treated. For patients and physicians, this opens a regulated pathway to obtain a treatment that has a very high rate of success. If this breakdown is useful, I want you to join our upcoming clinical trial discussion and webinar. There, we will go deeper on a case-by-case discussion about the endpoints of our trial, the access pathways for patients. And we share these live here on our channel, so you'll want to subscribe and tap the notification bell. If you're a patient facing amputation or a physician treating no option critical limb ischemia, you do not have to accept, "I'm sorry, there's nothing more I can do for you." ACP-01 is an option. Click below to speak with our team. We'll walk you through the data, the studies, and whether it may be appropriate for you to explore. If you found this helpful, subscribe for weekly information updates and clinician-led education talks. If you are a patient right now, you're not alone. Our research exists for you. Join our clinical trial.